Hey, everybody. It's Misty, of course. And I am so excited because this is the first Facebook Live all week long that we haven't had to reboot, start over, and send out a new link. So the gods are smiling on us. This is going to be an awesome Ask Me Anything with Dr. Aimee Shunney. Did I say your name right?
Yes, perfect.
Because, yes, I have to look at the phonetic everything. It's exhausting. Okay.
Sorry.
So Aimee and I have so much to talk about. I can't even believe the questions we got here. It's a list a mile long. I'm going to have to watch the time so we don't keep her here all night. If you have a question for Aimee, you can drop it in the comments. I will try to grab it and add it to the list, but I'm letting you know now we have lots and lots of questions. So just as a quick recap to refresh y'all's memory, we talked a lot about women's health and hormones and CBD with Aimee, which was a really awesome conversation. And Aimee, as you know, I had CBD come up in a couple other conversations on the summit. So this is one of those things that a lot of women are talking about. Mm-hmm. I have been doing I just call it the red CBD. You could
the raw formula.
There you go. And it's awesome. So I've been doing it in the morning every day because I just have a stressful career. You know, I'm in a leadership role. I am a little too type A sometimes, and I need to calm the F down. So I needed something just to kind of help a sister out, like help me not get so triggered and amped up during the day. Mm-hmm. And I've been loving it. So I'm really intrigued by the CBD conversation. I was talking to Peter Osborne, and I meant to ask him on our Facebook Live, and I didn't write it down. I had asked him before and didn't write it down, and we had all these other questions and ran out of time on his, but he was like completely anti-CBD. And I like to, I want you guys to see both sides, but he was anti-CBD because he was very concerned about the quality, the pesticides that are used and different things like that. And of course, his space is autoimmune. So he's dealing with women who are having so many issues, and people, when they go to him, are like super, super sick. So I can definitely see why he's like, just stay away from CBD. You don't know the sourcing, the quality issues, So he had a kind of a bias against it. And so Aimee, let's just start right there. So I'm sure I have not adequately represented his perspective, but it's a little blip, it's something that I think is a worthy point of view of, sourcing and all of that kind of stuff. I know that Stuart in his talk talked a little bit about the sourcing of the company that you guys work with. But in general, I think there probably is some merit to this whole sourcing conversation and whatever. So why don't we just start with that right off the bat? And then I have like a dozen CBD questions and others too. So we're going to mix it all up.
Okay, sounds fun. Thanks for this opportunity. It's really great to be able to talk to everybody. I think Dr. Osborne's right. I mean, I think sourcing is a huge issue. I only hope that he extends that same caution to all the other supplements that people come in taking, because it's an issue, frankly, with everything we put in our bodies. But it is a huge issue with cannabis and with hemp, because cannabis and hemp are bioaccumulators. So they are going to literally suck up everything that's in the soil that they're exposed to. So if there's heavy metals, if there's pesticides, if there's herbicides, if there's mold, if there, and on and on and on. Not to mention if there's solvents used in the manufacturing process. So it is crucial that you know where your raw materials are coming from, that the company you're using is doing third party, meaning an independent, third party that's not affiliated with the company comes in and does batch testing to look for molds and heavy metals and solvents and pesticides. The great thing about using a hemp product versus, for example, a dispensary bought marijuana product is that you're in the supplement space. So you can gravitate towards what I would call gold level supplement companies, which do third-party testing and provide certificates of analyses that anybody can see and look at, and that are transparent from the chemovars that they use, and whether it's GMO or non-GMO, and all of these things that we're talking about, so that the consumer, the patient, can know exactly what they're getting. This CBD space has exploded, as I'm sure you and all your listeners know. When I first started, I'd walk into a health food store, there'd be one company. I'd go to a trade show, there'd be one company. Now it's huge, right? And while I very much support the entrepreneurial spirit, I think there's a lot of folks that are small and they're growing stuff in their backyard. And I mean, and part of me is like, yes, that's amazing. But it's hard for these companies to be able to offer these kinds of safeguards like Dr. Osborne's talking about. And particularly if you have autoimmune, particularly if, you are multiple chemical sensitivity or having gut issues or a whole host of other issues, we got to be really careful. So sourcing is extremely important.
Yeah.
And I guess not a but an and, I think that you can find exceptional companies out there where you can get really great uncontaminated products, which can actually help modulate your immune system, for example, for an autoimmune patient.
Awesome. Yeah. Okay, that was awesome. Well, let's dive into a couple CBDs, and then I don't want it to be all CBD because there's a lot of other questions in here. And we only have you for a limited time. So I would love to get more of a professional opinion on CBD for sleep. I don't have a person that asked this, and usually I grab their names, but we had, I'm not perfect on this one. This is probably part of the reason why I have such a long list for you is they were flying in so fast. I wanted to make sure I asked the question. All right. I would love to get more professional opinion on sleep. I've been struggling with postpartum depression and insomnia for 2 years now and have tried so many supplements and things, yet not much relief. Thanks. And I want to say, so let's talk about CBD and sleep, but I also think this question is a bigger question than CBD. And sure, we would really be serving this person by addressing the bigger question too.
Okay. So thank you for saying that. I mean, and frankly, I think anybody who's out there dealing with postpartum depression and any kind of lack of sleep for 1 year, 2 years, whatever she just said, really needs to get some help moving forward. That's a long time to be suffering like that. So in regards to the CBD aspect of the question, I think CBD can be very helpful for sleep. Obviously, there's a lot of different reasons why people don't sleep. So part of what any good provider would do is try to figure out why that person's not sleeping. Is it a medical issue? Is it sleep apnea? Is it diabetes? Is it from pain and inflammation? Is it from anxiety? A lot of people that I see because of my patient population are women that are dealing with hormonal changes, which may be impacting their sleep, and also potentially people of all ages dealing with anxiety and not being able to quiet their stress response down, quiet their mind down. And these are areas where I think CBD can be incredibly helpful. If we kind of go back and look at the effects of CBD on the endocannabinoid system, we know that it is going to help quiet down the stress response. It's going to make us less reactive to stress, both at rest, when there's no stress, and also in the presence of stress. And we know that we have, human data that shows it helps with social anxiety, generalized anxiety, PTSD. So if there's an anxiety monkey brain, component to a person's sleep issue, I think CBD can certainly be helpful. If there's hormonal issues going on, I think that supporting the stress response is a really important part of helping with hormonal balance, so it can be helpful there. And I do think that pain and inflammation are another area where if that's what's keeping you up at night, if your hip is waking you up 4 or 5 times a night, that CBD can help with inflammation and pain, which could help with sleep that way. Depending on why the sleep is poor, that's going to dictate your dose and kind of, what you might be looking for. So for example, if your poor sleep is related to anxiety and not being able to quiet yourself down, you might find that smaller amounts of CBD can really do the trick to kind of, just kind of put the kibosh on that anxiety and help your brain and body get equally tired and help you drift off to sleep. If you have a lot of pain, you may find that you need higher amounts to be able to manage the pain. Likewise, I find that there's a dose if we go higher where we get more of a sedating effect, which is basically just looking to knock somebody out, which sometimes you need to do. That's not the goal of what you do all the time, but considering the excellent safety profile and the lack of adverse effects from CBD, if we have to use higher levels to knock somebody out and get them sleeping a bit initially, I'll go that route over other sedatives any day of the week. So I do think that CBD is worthwhile to try for sleep. It's helped an awful lot of my patients, honestly, in a way that with a level of success that I haven't seen with other natural sleep aids. So I really like it for sleep a lot.
Awesome. Okay, great. Another question. What do you think of Candida antibody levels in serum as a test for Candida? Which DNA test do you use?
So that was a quick
I know we're going
non-segue.
all over.
CBD, Candida. There was a time frame where I did the antibody testing a lot in the serum because it's kind of easier to get. And I just found it to not be as reliable. And I would very, very often get the IgM back, which would show that they've been exposed. And then I wouldn't get the antibody that would show me a current acute infection, and they'd still have the symptoms. And then I decide to treat them anyway. So I stopped using that. I use stool testing to look for Candida and other fungal organisms. I will use either a GI map, which does DNA PCR testing that I really like, or I will use Genova and have them actually do, in addition to the GI effects, have them do an extra kind of yeast KOH prep, which I think is better at finding fungal organisms. So I tend to, at this point, I'm using stool.
All right. Okay, this is kind of a longer one, but I think it gives some good information, good context, so that you can really provide a great answer. Okay. I have lost lots of weight in a short space of time without trying. I am quite badly underweight. I've lost a lot of muscle tissue and fat. I'm very weak and exhausted all the time. How can I build muscle and some fat back, but ideally in the right places? My breasts, my bum, and my face are the places that she wants. I have some health issues, which I'm also trying to address. Lots of gastrointestinal problems, including slow motility and SIBO. Gynecological problems include irregular periods, reoccurring dermoid ovarian cysts, pelvis pain, pain under the left rib cage and side and under the left wing, lots of joint pain, headaches, heart palpitations, POTS, possibly EDS. My TSH was checked and it's within normal range. My twin sister and older sister both have Hashimoto's. I am waiting for FSH and LH and estrogen results. What other hormones or other tests could be recommended for me to do? And what do I need to do to put on weight healthily and give my body strength to fight other issues, please? My physiotherapist doesn't recommend exercise, saying I am too weak. So I did on this thread, I want us to go deeper than I recommended the basics. You got to do the gut healing and all the stuff that we kind of know. So you can go through that, but let's go through that fast. And then if there's anything else you have to offer her for her situation, that would be amazing. And we could all learn from it.
Yeah, so that sounds like a very complicated case, and I hope that she has found her way into someone's hands who's doing functional integrative care. Obviously, she needs to resolve the gut issues, right? And the SIBO needs to be treated. So, SIBO is one of these things that if you're out there in the integrative, functional naturopathic world, we are treating, am I allowed to swear? A shit ton of SIBO, you need to make sure if you're listening, my dear, that you are treating somebody you're working with somebody who's very familiar with how to treat SIBO, because it's treatable. But treating SIBO, by the way, involves that whole kind of, the 4 R's of gut restoration. It involves looking at the food that you're eating. It involves looking at the gastrointestinal barrier for leaky gut intestinal permeability. It involves making sure that you have adequate digestive enzymes and hydrochloric acid, the whole 9 for digestive function. It looks at eradicating the SIBO, which, contrary to what some doctors will tell you, there are many ways to do. There are antibiotics, and then there are lots of herbal alternatives too, which can be just as effective. And there's different ones to try if the one you used didn't work. And then there's a third stage that involves looking at motility and restoring health to the migrating motor complex, which is the part of the gut that handles kind of digestion and then cleaning and make sure that all the bacteria go where they belong to and don't get marooned up in that small intestine as with SIBO. So somebody really needs to be working with you on SIBO, and then if you've got like the whole kind of POTS, EDS, chronic fatigue piece, there may be a chronic viral infection. There's a lot going on here. So it to me, it's a much bigger question than how do I put on weight, right? Because part of what we / your healthcare provider have to do is figure out what's going on and restore your health. When your gut health is restored and you start to move in the right direction, eradicating any kind of chronic viral infection, for example, your body should begin to move back towards its more natural set point in putting muscle on. It's hard when you can't do exercise. I wonder if you could get an approval to do more mild work. Can you do Tai Chi? Can you do Qigong? Can you do yoga? Can you do light strength training or Pilates, even without weights, with resistance, things that can be at least building muscle mass for you. Sounds like I didn't get all the details of the hormones that were being ordered. I would certainly make sure that DHEA and testosterone are on that list, since they are so important for muscle mass and body composition. And obviously, good quality fat, which we all need, making sure you're getting adequate protein and good quality fat will help make sure that you're able to put weight on, and the right kind of weight. If you have SIBO, I would imagine you're on a pretty carbohydrate restricted diet as it is. And SIBO diets can actually, exacerbate weight loss. So you need to work with your practitioner about additional things that you can add. Can you add more jasmine or basmati rice? Can you add more quinoa? Can you add pumpkin? Can you add some more tofu? There are things that you can add in the SIBO diet to make sure that you're getting more dense nutrition. Because if people keep losing weight, you've got to back up on your SIBO plan, because that's clearly unhealthy unto itself. With the level of complexity, I don't feel like that was a terribly effective answer, but I think that's about what I can say, given how much medical is going on there.
Yeah. Awesome. Alrighty. Hair loss. There's actually 2 questions about this, maybe 3, and they're all really similar. One person said, what causes hair loss in women? Another person said, I work at a health food store and women are coming in all the time as they go through menopause talking about losing their hair. And I really wish you would have talked about this more on the summit. What do we tell these women? What can women do that are entering menopause and losing their hair? And then another person said, what supplements do I take? How do I heal it? This person says she's on a keto diet, I'm guessing. And she thinks hers might be connected to stress and anxiety. So why don't we just kind of take on this hair loss question? I hear you women, by the way. We will talk more intentionally about hair loss because I know it's a big deal.
It's a huge deal.
It hasn't been my deal yet. I have very thick, ridiculous hair. So it's not on my radar, but I hear you ladies. We are going to talk about hair loss. Okay.
Yeah. Well, I think it's important to women because, you lose your hair and it's
yeah, I would feel that way. My vanity would kick right on in. Let me just tell you.
I was looking for a better word and I couldn't find it. But
I'm just going to claim it.
No, and I see patients all the time and it's on the top of their list, right? So, there's so very many things that can cause hair loss, and, somebody needs to obviously work this up for you. And I think everybody, each one that you mentioned kind of brought some things up that are important, right? So, certainly stress. Stress can cause just a huge transient acute hair loss, which then people come back from later. Obviously, autoimmune illness can cause hair loss. Thyroid disease can cause hair loss. Not enough to look at TSH. I'm sure all your people know this already. They need to look at free T3, free T4. Free T3, I find a lot will often have to do with hair. Also, thyroid medicine Ironically, thyroid disease can cause hair loss. Thyroid medicine can cause hair loss. And so sometimes you need to work with the thyroid medication that somebody is taking when there's a thyroid issue.
Is
Other
there one
things that can,
medication that will be more than others causing issues on thyroid? Or is it
you
all of them can cause it?
all of them can, but usually where I'm going to hear about it is with a pharmaceutical T4. So if somebody's
Okay.
on a Synthroid or on a levothyroxine, Levoxyl, but at the same time, sometimes I'll switch them to one of those and they'll stop losing their hair. So it's not a categorical difference, but it is absolutely something that should be on your mind. If you're thinking about, I just switched my thyroid and now I'm noticing, oh yeah, that's happening. So think about thyroid medication, optimizing thyroid. Absolutely. In menopause, perimenopause, as estrogen and progesterone levels change, we can see hair loss start to happen. There can be an androgenic alopecia that happens. A lot of the estrogens that are circulating in our bloodstream post-menopause are actually derived from androgen precursors that are made in the adrenal glands, for example, androstenedione. And those androgenic estrogens can kind of act more like testosterone and DHEA does in the body. And just like with PCOS, when a woman can have elevated testosterone or elevated DHEA, she might start to notice extra hair growth on her face where she doesn't want it, and then losing some of the hair on her head where she does want it. So that's a picture you can see in PCOS. And then that's also a picture that you can see perimenopausally and postmenopausally. I also always check B vitamin levels and iron levels, specifically ferritin, which is a storage form of iron. So I don't just look at a CBC. I'll look at a CBC, which is a complete blood count, and ferritin. I often find that low storage iron can be very much associated with hair loss. B vitamins also, biotin, interestingly, many of you may have heard of as being something that can be taken for hair loss. Biotin is part of the B complex, and high levels of biotin can be very useful for hair. Interestingly, iron and B vitamins have some effects on each other in regards to absorption. If you have gut issues, if you don't have enough hydrochloric acid, if you have SIBO, oftentimes it's the B vitamins and the iron that start to go down first. So, so again, I'd mentioned autoimmune disease, gut illness, all of these things can contribute to hair loss. So when somebody comes into my office and that's their chief complaint, I'm looking at every single thing on that list I just mentioned.
So from a treatment perspective, I'm thinking of my own experience as a woman in this space. Like my experience going to doctors a lot of times, and even now, and I have a wonderful functional medicine doctor in Austin. If I go in with an issue, they might have one thing off the top of their head that,
Sure.
that they want to try, but they aren't necessarily going to be super well versed in like a variety of protocols or whatever. So I'm listening to you talk and I'm just wondering, when it comes to hair loss, are there a few like building block things that if you do these things, you're going to hit 60 to 80% of the causes? Like if you really work on your gut health and you take a look at this and you do this, will that kind of cover the majority of that hair loss piece, or is it just complicated and vast?
Well, I certainly think that, doing things like making sure there's adequate essential fatty acids on board by taking fish oil or algae oil and eating fish, potentially adding GLA, which is gamma linoleic acid from evening primrose or borage, which doesn't replace fish oil, but is a wonderful complement and has a great affinity for hormonal and cyclical hair, skin, and nail stuff. Having a high quality B complex vitamin that's got adequate amounts of biotin in it, and that has the B's in the methyl form, if you can tolerate that. Having a multivitamin that has a small amount of iron in it. I think that those kinds of things, and a probiotic, I don't know if I said that, but a good probiotic. I mean, those kind of things are a good foundation for so much, right? And in regards to hair, it will certainly cover any potential basic nutritional cellular kind of deficit there. And from there, you really got to zero in on like, is this thyroid? Is this sex hormone? Is this stress? Is this gut? Is this autoimmune? And then from there, there would be different things that you would do. If it was thyroid, you're trying to optimize the right medication and the right dosage of the medication. And in particular, you're looking at getting that free T3 up into the upper part of the reference range. If it's stress and anxiety, you need to look at how to help them manage stress, manage that cortisol response. CBD comes in great here. Phosphatidylserine, magnolia and epimedium, kava and ashwagandha and rhodiola and adaptogens, right? If it's estrogen, progesterone, perimenopause, you can look at maca. You can look at actually using hormones, Vitex, black cohosh. If it's a testosterone thing, I've had some good luck with peony and licorice, which is actually a 1-to-1 Chinese formula that a lot of people use for hair loss. Green tea. There was a really interesting small study on just 3 to 5 cups a day of spearmint tea. And I've actually had patients use that and really like it for their hair loss. So, the good news is that there's a lot you can do. The maybe not as good news is that it can just take a little detective work to figure out exactly which path you need to go down.
Okay, awesome. Alrighty. Debbie asks, what about the safety, necessity, or reliability of mammograms?
Safety, accessibility, and reliability?
Necessity and reliability. So like
necessity,
should be getting mammograms. How often do you think we should be getting mammograms? Do you think they're reliable? Like, I guess just speak to that issue. And I think this is, if I'm reading the tea leaves here, she's asking
how often she needs to get one.
How do I need to be screening for breast cancer? So,
yeah. So, I don't think the mammogram is perfect by any means, but I do think it is what we have, and it is worthwhile to do. The question is how often to do it. I think that the data supports that our frequency of screening is not necessarily helping us catch more cancer, and in fact may actually be catching more kind of what I'll call a benign cancer or a stage 0 cancer that's not necessarily going to turn into anything dangerous and is going to lead to more potential procedures, just more medical intervention that's unnecessary. A lot of the data that I've looked at talks about, for a woman in her 40s or 50s who does not have any family history, that every 2 years seems to be adequate. Again, I think it's a real personal decision. And I think you have to look at your family history, and particularly if you have a first degree relative, a mom or a sister who has had breast cancer. I think there's genetic testing you can consider doing to help understand what your risk might be. I think that when I talk to my patients, we look at their diet, we look at their weight, we look at their, how sedentary they are, if they're exercising, if they smoke, what their alcohol intake is, because all of these things can increase or decrease their risk for breast cancer. And so, I know that conventional medicine doesn't love this, particularly in the public health realm, but this is not necessarily a one size fits all situation, certainly not for me in the way I recommend it in my practice. There are people who I really encourage to go every year. And there are people who, I say, I think you would be fine if you go every 2 years. And I have many who don't go very often at all. And, I try to do what I can, even though we're not supposed to really do clinical breast exams anymore, because apparently they don't help. And self-breast exams are apparently useless. I teach all my patients self-breast exam. I encourage them to know what their breasts feel like. I figure you're going to be way more likely to find something irregular and new in your breast way before I do when you come and see me. And that's the quickest way to figure out what's going on. The other thing is that when you do get a mammogram, they will rate your breast density. And if you have a category 3 or 4 breast density, your insurance will cover something called ABIS, which is automated breast ultrasound. Now, when I say it will cover it, that might mean they'll cover it after you hit your $8 million deductible, but they will cover it. The reason that I think it's so important is because even if you pay out of pocket for it, it's usually $200 or so. And what it does is it makes about 30% more likely that that mammogram that you're getting is they're going to actually be able to take and interpret that information in a more meaningful way. You have a 30% more chance of finding a cancer that's there. And that's because when you have dense breasts, it's harder to see. And so the ultrasound is an extremely important piece of that. So, I tell patients, if you're going to do the mammogram, and you have dense breasts, you owe it to yourself to do the other piece of the screening. I think it's negligent that they don't just do it, but they don't yet. So I do think that, in the context of being one's own advocate, it's important to ask for that as well.
So in the functional space, I hear a lot of talk about choosing thermograms instead of mammograms.
Mm-hmm.
Do you have thoughts on that?
Yeah, I don't think it's a good idea. And I'm sure a lot of my colleagues would not agree with me. I was so excited about thermography when I learned about it when I was in school 20 years ago. And when I was in my residency, I was in an office where we had somebody come in and do thermography on a monthly basis. I think it would be great to do thermography along with mammography, but to use it to replace it, I think is dangerous. And I certainly wouldn't be comfortable for myself or, telling any woman that I cared about or my patient or my mother or my sister to forgo mammography and just use thermography. I think it's fascinating. I have really wanted the data to come out and support this in a way that it simply has not in 20 years. And in fact, about 5 years ago, the Canadian College of Naturopathic Medicine came out in a position paper against using thermography because of the potential dangers of using it instead of mammography. And what I noticed here in Santa Cruz, where there are several naturopathic offices that offer regular thermography, is that if somebody has an irregular or an abnormal thermogram, they will put them on supplements for whatever the time is, 6 weeks, 3 months, 6 months, repeat the thermogram. And if the irregularity is still there, they send them to get a mammogram. So for me, I just feel like it's better to be safe than sorry. And I don't feel comfortable switching teams yet here.
Mm-hmm.
I would like to.
Yeah. So mammograms are superior to thermograms. Why? Just so that we're clear on that, because I can tell that you have a reason that you like the mammogram better than the thermogram, but you didn't say it out loud.
I think that the mammogram is more likely to do what you want it to do, which is to find breast cancer. And
okay,
that's
so it's
what
just
we're
a
doing
more
this
reliable
for.
test. Got it.
For that, yes. I mean,
Yeah.
Thermography, anyway, I don't know how much more time you want to spend on it. I think thermography is fascinating. I understand that tumors grow blood vessels. And so the idea with thermography is that we can see a tumor growing 6 to 7 years before we might see it on a mammogram. But I've yet to see that really bear out in the way that we're preventing breast cancer. And what we really need is for women to be getting screening so we can find it and do it quickly.
Okay. Karina asks, I've always had eczema and acne, and I have two close relatives dealing with serious chronic skin rashes, dark, raised, itchy scarring. We've all seen lots of doctors, taken lots of supplements, and paid lots for tests, but no resolution yet. We each have Hashimoto's and have been eating gluten and dairy-free for a long time. Also tried the Walls Protocol, paleo, and no histamine diets without a change to the skin. This is affecting different generations and male and female. Looking for where to start now since food doesn't seem to make a difference. Environmental, as far as additives, soaps, etc., has also been addressed. So we're curious what to look for next and hoping someone can help as we're desperate.
Can you describe the skin lesions to me again?
Serious chronic skin rashes. Once she says, I've always had eczema and acne, and I have two close relatives with serious chronic skin rashes, dark, raised, itchy, and scarring.
So it sounds like, you've gone off certain foods, and it sounds like you've tried different styles of eating. I don't know if she said this, tell me, but I think where I would go is gut health. And, so actually going to look at food sensitivities, food allergies, leaky gut, looking for dysbiosis in that way, and maldigestion issues too, hydrochloric acid and digestive enzymes. I would definitely go do a deep dive towards the gut, and I'd probably look at hormones as well. Those are the two places that I think I would go. Did she that was a longer one? Did she say that she has gone in either of those directions yet?
No, no. She says that she's tried the Walls protocol, paleo,
Mhm.
and no histamine diet. So it seems like she's done the food piece, but
Right.
not necessarily going into the deeper gut healing
The gut
things.
healing, right? Which I think
Hmm.
is definitely, I mean, remember your skin is your biggest organ of detoxification, right? So we really want to make sure that your gut, your liver, your gallbladder, everything is functioning as it should be. Um, and I always say there's a big skin gut connection. And then of course, looking back on, is do you flare up around your cycles? Does there seem to be any kind of cyclical nature? What are testosterone levels looking like? I think it's great that they removed gluten. That would definitely have been something on my list to see if that would impact the rashes. I'm really surprised that they didn't get any relief with the histamine diet. I don't know how detailed you were with that. That's not an easy diet to follow. You might want to go back and look at that. There's various histamine resets and other kinds of programs you can find online that might be really useful. There's some great histamine supplements that you might want to try on top of the food as well. Although, frankly, I mean, I agree with you. If a really good try at a low histamine diet didn't do anything, I don't know that I would keep going. But I do find it really interesting that wouldn't touch it at all, because it does seem like it's somewhat inflammatory in nature. Go to the gut. Always go to the gut.
Yeah. All right. Dorota asks, for the last few months, the second I wake up, my system goes into panic mode and anxiety. Very fast heart palpitations, 100 plus pulse.
Hmm.
Sometimes that wakes me up from sleep, and the panic forces me to get up even though I am really sleepy still. And then my muscles, especially my legs, are tense. I'm shaking. Mind races, sense of urgency and panic in me. This usually subsides after an hour or two. Sometimes it wakes me up in the night, not during the day so much. I don't have any external stress causes in my life. I'm lucky with that. I'm 46 years, single. My heart is fine. I had that checked. Have estrogen dominance. Thyroid is fine. My mercury was only slightly elevated years ago. No amalgams. Perfectly clean diet. What could be causing it? My naturopath doesn't know. She's done every test. I have been searching everywhere for so long. And if the speaker might have an idea what could be causing me to feel this way, can they suggest what I can do to help make it go away, as it's impacting my social life, my everyday life, and I'm holding off on getting a job until I sort this out. Thank you.
Oh, that sounds awful.
Yeah.
So, she said that she doesn't have any external stresses in her life, which is great. I mean, the first thing that I was thinking of, as you were reading it to me, was some kind of PTSD or past trauma that's resurfacing. I mean, I've had lots of patients who present the way she described because of that. So I'm assuming that that's not the case. She said no external stressors. She didn't say no previous trauma.
Yeah.
Obviously, if there's previous trauma, please, psychotherapy, EMDR, cognitive behavioral therapy. I mean, there's, so many things, trauma release exercises. I mean, the list goes on and on of things that can be done, really good trauma work that's available. Because obviously what it sounds like more than anything, particularly if your heart has been checked out as okay and you're not hyperthyroid, is that there's some kind of major cortisol response that's happening for you during the night.
Could that be from
Your
parasites? Is that too extreme for what a parasite reaction would stimulate?
It's not one that I would say is very common. I mean, parasites are pretty tenacious little buggers, and sometimes they can really surprise you. Um, it might be interesting to do a GI map and rule that out. I assume the naturopath has done an adrenal test that would look at cortisol levels, including during the night, and so would have potentially caught that. Sometimes there can be blood sugar dysregulation, and if I know she's got a clean diet, but if blood sugar spikes and insulin spikes, and then drops. You can get a cortisol spike during the night, which can wake you up in a panic. And she says she's 46.
Mm-hmm. Yeah, and she's waking up in a panic state, it seems.
Right, waking up in a panic. The other thing, it's not quite fitting it, but, sometimes I do see women who are having, and 46 is not that young for menopause. Menopausal women will often experience, heart palpitations and panic kind of in place of, say, a night sweat or hot flashes like that, but it doesn't totally fit that way either. Let's see, thyroid, blood sugar, hormones, guts. It seems like something is stimulating her in her sleep cycle like that. I wonder if it's potentially worth doing a sleep study to see if she's got sleep apnea at all and maybe isn't breathing well at night, and so therefore is waking up panicked because needs oxygen. Mm-hmm. And you wouldn't suspect that in a healthy 46-year-old woman, right? But that's possible too. Those are the best things that I can think of.
Awesome. Yeah, I think it might be worth considering the trauma thing, even though you don't think there's stress in your life now, and maybe there isn't. It's very possible that past trauma could be creating a situation like this.
If I had $1 for every patient who told me that, well, they had this happen to them when they're young, but they've worked through it and it doesn't bother them anymore.
Right.
And then have it come back and realize that, these things, and they creep up on us at other times when we're not, maybe we felt like we were over it. Yeah. And then something happens, you come home one night and there's somebody in your driveway, just a fluke, they were in the wrong driveway, and set somebody off for months because of some old trauma that happened at night. And, so just, that's something that certainly, she should make sure that that's not a piece of her puzzle. Oh yeah. Cause that'd do it by itself. That'd be it.
Yeah. All right. Adriana asks, is there any way to push DHEA to convert to testosterone instead of estrogen? I know licorice can push the aromatase enzyme and increase estrogen.
Right. And in women, we're going to tend to push DHEA more towards estrogen anyway. DHEA towards testosterone. Yeah, I don't know. I think personally, if I were trying to get somebody to have more testosterone, I think there would be much better, more effective ways to do it than to try to get DHEA to do it. Frankly, I would give testosterone, and I realize that's another ball game for people, right? You can go to the store and you can buy DHEA, but you need a doctor to prescribe you testosterone. But I just don't think that we can reliably manipulate that hormone soup in there. I think that if we could do it better, this whole art of hormone balancing that my entire life is about would be so much easier. Yeah. So it's easy for me to say I would use testosterone because I can prescribe it. But I do also think that there are herbs out there like maca. And in particular, there's a brand that I'm not affiliated with called Feminescence that separates their maca based on genotype. So they're basically using different genotypes of the plant based on the therapeutic benefit that they want. They find that different genotypes can have different effects. And the maca harmony, which can be used for premenopausal women and also for postmenopausal women, has a real affinity for a lot of the things that we look to testosterone for. They've done studies on that product up 3, 6, 9, I think all the way up to 12 months. And they've seen improvements in a lot of kind of the testosterone related parameters, things like libido, things like muscle mass and body composition. So, and of course, the nice thing about maca is it's kind of like it covers your whole endocrine system. So it's affecting estrogen and it's affecting FSH and it's an adaptogen. So it's kind of getting you across the board. So I don't know that I would, even if I had like a herbal cofactor that might move the enzyme from DHEA to testosterone, I think that if what you really want is more testosterone, and I would imagine the effects you associate with it, you'll do better with either testosterone or something like maca. Interestingly, I find that my patients who take DHEA, if they take lower doses, I don't see the testosterone push so much. But if they take higher doses, like there's some studies out there of women taking like 25 to 50 milligrams of DHEA, which is a high dose for women. I'll tell you that right now. It can give you a mustache. Be careful. But there is some data that shows it really helps with libido. And I think part of that is because you're giving that higher dose, and therefore you are going to get more conversion to testosterone.
All righty. Heidi asks, how does one lower estrogen toxicity? Can cannabis tinctures help estrogen toxicity? How can we increase progesterone without using synthetic hormones?
So I'm going to assume that when she says estrogen toxicity, she means like estrogen dominance.
Dominance. That's what I assumed as well.
That's what I'm thinking, because of course that can be toxic, for sure. So, we talked about this, I think, in my talk with, regarding estrogen dominance. There are several different ways that you want to address it, as you're trying to kind of even out that estrogen to progesterone balance. So a lot of it has to do with enhancing detoxification and metabolism of the estrogens that you do have, and then helping to balance potentially with more progesterone, because we tend to really get low in our progesterone earlier. Between the ages of 35 and 50, our progesterone levels drop about 70%, whereas our levels of estrogen only drop about 30% during that time. And it tends to be much closer to 50 when the estrogen really starts to tank. So progesterone is kind of like this slow, gradual decline. So, it's interesting. CBD can help in the sense that part of what exacerbates estrogen dominance is stress, because when you're producing lots of cortisol and stress hormones, your body's basically stealing your progesterone to use it to make more of the stress hormones like cortisol. So ostensibly then, anything that you use which helps create a healthier stress response, like CBD or other adaptogens, is going to decrease that progesterone steal, which is going to leave you with more of your own endogenous progesterone. You can supplement progesterone with bioidentical progesterone, which is not synthetic, and you can miraculously get that over the counter from several reputable companies in a progesterone cream. You can also get progesterone orally by prescription. You can get sublingual preparations, etc. So you don't have to use a synthetic progestin, right? So there's synthetic progestins and there's progesterone. And synthetic progestins, a lot of women don't tolerate well from a mood or energy perspective. And there's also some data that shows that synthetic progestin may be the culprit in the hormone game when it comes to some very small but still increased breast cancer risks with hormones. Seems to be much more related to synthetic progestin, not so with progesterone, which you can get. Other ways to decrease estrogen toxicity or dominance would be to eat organic, avoiding pesticides, chemical fertilizers, herbicides, things like that. They are endocrine disruptors, so they actually have more of an estrogenic effect in our estrogen receptors than our own estrogen. So cleaning up your diet in that way is extremely important. Eating healthy phytoestrogens like from flax seeds or soy isoflavones. I know a lot of people think soy is dangerous. Soy isoflavones have 1/1000th the bioavailability in an estrogen receptor of our own estradiol. So if you have a lot of estrogen and estrogen toxicity, and you're including some of these phytoestrogens in your diet, you're actually going to lower the estrogen effect at the receptor site. Also enhancing the way you metabolize your estrogen. So things like DIM and indole 3-carbinol will help you do that. Methyl B vitamins are really important here. Glutathione is really important here. So lots of ways to help with estrogen dominance, and CBD can help in regards to the stress component.
Mm-hmm. How would you dose DIM and the other one that you said that I can't repeat back to you?
Indole 3-carbinol.
That one.
So they're kind of different versions of each other. You have some doctors who swear by DIM. I think indole 3-carbinol is 2 molecules of DIM that are linked together if I remember. Some people say one or the other is more bioavailable. A lot of supplement companies just get out of the fight and put both of them in their supplements. I generally just use DIM, and I use somewhere between 100 and 300 milligrams, depending on the severity of the estrogen dominance that I'm looking at. And I'm usually looking, in order to gauge that, I'm usually looking at an estrogen metabolite test in urine and actually looking at how much estradiol and estrone do they have, and then looking at the different metabolites and what the ratios are and what that looks like. When you use DIM, you will see somebody's overall estrogen come down. So you have to be careful, because sometimes somebody has lousy estrogen metabolism, but they don't have much estrogen. So you have to choose carefully.
Yeah. Okay. I know we're getting close here on time, so we're going to keep going, ladies, but I'm probably going to get into all the questions. All right. Adrienne asks, since CBD can lower blood pressure, do you find it's okay to use in adrenal fatigue at maybe a lower dose?
I think that starting with a low dose is always smart, no matter what. Just simply because people respond differently to cannabinoids based on their own endocannabinoid tone. And you might think that you're a real smarty pants and you know exactly what they need. And you will find that you are still often wrong. It's very humbling working with cannabinoids. It's similar to working with hormones. So I would say always start slow, and you should be fine in regards to blood pressure.
Okay. Next question is from Cornelia. Does not having a gallbladder affect toxicity and removing toxins from the body?
I'm trying to think of exactly how to answer this. I mean, not having gallbladder, even though conventional medicine tells us we don't need a gallbladder, not having gallbladder can be a real problem for some people. The interesting thing is that a lot of people seem to somehow be okay with it. But then again, a lot of people walk around quite sick and think that's normal, right? Where I see that where it's most of an issue is in the production of bile. And of course, bile is extremely important for digestion and therefore detoxification and what we do with toxins. So in that regard, I think it at the very least has an indirect effect on detoxification based on how it impacts digestion. I have most of my patients who don't have a gallbladder on some ox bile to enhance their ability to emulsify fats and support digestion and gut health.
Okay. Paige asks, I would love to hear more about how CBD helps women in menopause.
Yeah, so I'd love to tell you that I have really great data that supports that it helps with hot flashes and night sweats and things like that, and I don't. But I do know that, insomnia is a huge issue for menopausal women, that anxiety and mood swings and fluctuations is a big issue for menopausal women. You might not know, but pain and inflammation is actually one of the top 3 complaints of menopausal women. A poor stress response. I'm agitated, I'm impatient, I'm yelling at everybody that I love. My children think I'm a monster. This stuff is all really important. And so CBD can come in and impact all of these areas in a positive way. The other thing that happens in menopause is as estrogen decreases, unless we replace it, we are losing a certain amount of protection in the cardiovascular system. We are more prone to prediabetes and insulin resistance. And, CBD has impacts metabolically that can really help us in that department as well. So I think that CBD can really come in, help with the stress response, help with anxiety, help promote a good night's sleep, help reduce inflammation, and help with overall health by means of creating better endocannabinoid tone. So I think it's a wonderful tool to have in the toolbox for every and any perimenopausal and menopausal woman. I love supplements that hit more than one system at a time, right? Because the idea is that we're not just symptom managing, but we're actually trying to get underneath and create more balance. Obviously, the only thing that cures menopause is, hormones, because menopause is a loss of hormones, right? So there's nothing medically wrong with menopause. It's a functional issue. And a lot of women do just fine with recalibrating during that transitional time. Other women really need a lot of support during it. And certainly managing the stress and the psycho-spiritual emotional components is a big part of what's happening. It's a big transition. And I think CBD can be really useful there for women to try to, stay more present, have less of an emotional and reactive response, and to take all the steps that they need to take for self-care, which is really paramount at any stage of life, frankly, but certainly in menopause as well. And we don't do that so well, do we, ladies?
Yeah, right.
Yeah.
Okay, I think this is going to be the last question.
Okay, make it a good one, Misty.
I'm going to make it as good as we have on the list. Terry says, when you have thinning of the skin noticeable in her hands, is that a sign of low estrogen?
Only in your hands?
Noticeable in her hands.
Noticeable in her hands.
Potentially,
so
she doesn't say
she means
potentially. Here. That's what I would guess as well.
Right. I think it is. I mean, we lose, I forget I probably have on purpose forgotten the percentage because I don't want to think about it. But we lose a ridiculously large percentage of collagen and elastin in the first 3 years post-menopause. And then it mellows out a little bit, but we continue to lose about 3% every year after that. And a lot of that is related to what's happening with the changes in estrogen. And so when we see thinner skin, obviously in places with thinner skin, we're going to notice it sooner. So in our hands, that little lovely little crepey thing that happens in your inner arm, women notice vaginal dryness and vaginal atrophy. That's very thin skin to begin with too. So those are some of the first places that you are going to see it. Estrogen can be helpful, but it's not going to fix it. It will fix it vaginally. So, I mean, there's that. That's good news. But, in all of this other wonderful skin that holds us all in, we are going to have to deal with a certain amount of thinning and change as we lose some of those vital hormones, including estrogen. There's a lot of fantastic aesthetic medicine things coming down the road for people who want to pursue those. Lots of things with lasers and different kinds of radiotherapies and
PRP.
PRP. I mean, it's an interesting time to be aging. For sure.
No, that's what I think about it. No. Yes. Yeah. Total resistance. Yeah. There's no Buddha in me at all when it. Just saying.
I gotta keep it real,
I think real, baby.
I mean, to pretend that I'm just gonna sit here happily and go crepey into this good night. I mean, forget it.
Crepey. Yeah, forget it is right. All righty. Well, I have more questions, but I know it's time on your side. Thank you so much for spending time with us. This was brilliant.
Pleasure.
And I've been listening to these women and interacting with them in the Facebook group all week. And I know that the insights that you're providing is really valuable, where we all care. And this is a special group of women that is super engaged in really figuring out what's going on for themselves. And, when you're on this side as a patient, you're at the mercy of the expert in front of you, helping inform you. And I think the most valuable thing that Healing Rosie can do for all of these women is to expose them to a variety of points of view and perspectives on what is possible in healing our bodies. So thank you for
everything you're doing. I mean, I think you're providing such an amazing opportunity for everybody. And I love being able to participate. Education is powerful, right? And what so many of your talks had in common was that they were about being your own advocate. I have some of the smartest, most amazing patients and women I've ever met, and they're just fierce. And I love that. They inspire me every day. And if you have additional questions and you want to get them over to me, I might regret this, but I'm going to say it anyway. You just send me, you can email me through my website, anybody, drshunney.com, DRSHUNNEY.com. There's also a ton of free info on that site. If people want to read more or look at some podcasts or read some articles or things like that, a lot of CBD information. And I do take new patients, and I do distance consults too. So people can, if they need a little more individualized hand-holding and I can be helpful, they can get in touch for that too.
That's awesome. Well, thank you so much, Aimee. I loved it. I wish we could like just girl talk it for the next hour. Thanks
I
for making
know. I
time.
know. Well, thanks for
Well,
everything, and good
yes.
luck to everybody out there. Yeah.
Yes. Thanks, everyone. Thanks for joining us.
Okay.
Have a good night.
Thanks, Misty.
Bye.